Erica from Kenny Brother Farms, and today I'm going to be talking to you about the National Institute of Health Stroke Scale, or NIH scale for short. But there's a couple things you should know before we get started. First, the assessment tool is best used on patients 18 to 64 who have recently had a stroke. It has a 6-month ceiling, so it's most beneficial to use it within the first 6 months, and it can be used as an initial screening tool. Here on the farm, we do it all, kind of like the NIH Stroke Scale. Did you know it tests 5 different body functions, including aphasia, behavior, cognition, dysarthria, and vision and perception? The NIH Stroke Scale is as valid and reliable as this grain silo is tall, and it's the tallest in Gratiot County. How do I know that, you ask? Because it's proven over and over again to have inter-rater test reliability in several studies, and is proven valid in predicting outcomes and even more. That's probably because the NIH Stroke Scale has specific instructions for the test administrator. Here at Kenny Inc., pickles are out of season, but patients have strokes during all months of the year. The NIH Stroke Scale can be performed anywhere at any time of the day, just as long as you have the patient, a pencil, the assessment tool. Oh, and be sure the clinician has taken the proper training course to be able to administer it. The best part, it only takes 6 minutes. Brine, smells like money. This sugar beet harvester is one of the most efficient on the market. Kind of like the NIH Stroke Scale. One of the strengths is how it is so time efficient, and another one is how it is accurate in determining recovery outcomes based on the score. Limitations include redundancy, especially ataxia, which is tested in multiple questions. And did you know left middle cerebral artery infarcts score an average of 4 points higher than right middle cerebral artery infarcts? This is because the test favors speech and language over sensory functions. I love to sit out here and observe my cornfield, and the best part, it's completely free, kind of like the NIH assessment tool. It's an observer type assessment tool that's completely free online. The test gives a therapist a good prognosis of a patient's skills and abilities after experiencing a stroke. It's pretty good at predicting outcomes too. Did you know scoring above a 25 indicates a severe stroke and the patient probably will not be able to be independent? Lower scores indicate better prognosis and maybe even a full recovery. Although this assessment is pretty good at determining outcomes and prognosis, more assessments will be necessary to determine post-acute treatment plans. This is Farmer Madison with her chicken chirp. Hey, Madison, do you know what month it is?
It's September.
And how old are you?
17.
Great job. If this was question 1B on the NIH assessment tool, you'd score 0 out of 2, indicating no impairment. That's just one question out of 15. We'd have to ask the others to figure out your real score, which could range from 0 to 42, with higher scores indicating greater severity. Other questions, like question 5, may ask the patient to perform simple commands, like holding your arms out at 90 degrees for 10 seconds.
NIH Stroke Scale is a systematic assessment tool that provides a quantitative measure of stroke-related neurological deficit. The NIH Stroke Scale was originally designed as a research tool to measure baseline data on patients in acute stroke clinical trials. Now, the scale is also widely used as a clinical assessment tool to evaluate acuity of stroke patients, determine appropriate treatment, and predict patient outcomes. It can be used as a clinical stroke assessment tool to evaluate and document neurological status in acute stroke patients. The stroke scale is valid for predicting lesion size and can serve as a measure of stroke severity. The NIH Stroke Scale has been shown to be a predictor in both short and long-term outcome of stroke patients. Additionally, the stroke scale serves as a data collection tool for planning patient care.
That's all today, folks. Thanks for watching. See you next time on Erica's Adventures on the Farm.
She likes the way it's pulling while we're tilling up the land. She's even kind of crazy about my farmer's tan. She's the only one who really understands what gets me. She thinks my tractor's sexy.